basic information about, how they can access an influenza vaccine. And particularly today, I just want to share with you, how we are trying to make it easier for parents who are currently in one of the busiest times of the year to get their kids vaccinated. We've had a very strong and enthusiastic response to the influenza campaign. We've vaccinated over 1.5 million people, which is much above last year, and I believe getting to a record in the province. We've used about 70% of our vaccine, and we have more in the wings coming in to make sure that everybody has a chance who wishes to get vaccinated. And generally, with the high-risk groups that Dr. Henry has identified, we're doing well. Over 50% of seniors over 65 have been vaccinated. We do track people with chronic illness so that we can prioritize them. 40 to 45% of them have come in and got an influenza vaccine. Really our concern, as Dr. Henry has said, is children, particularly those who are 6 months to 4 years who are in the highest risk group. They're the most vulnerable. And amongst those children, we have only 20% have been vaccinated. For those 5 to 11, 20% have been vaccinated. And for our teens, only 15%. So I think our call out today is to all children and youth, and particularly the small ones, to make that extra effort on behalf of their parents to get them vaccinated. Now, I think the public are very familiar with the Get Vaccinated system. It's a remarkable way that they can be notified of when a vaccine is due, and they can go in and, book themselves or their children a vaccine in one of many options that is convenient for them. To date, though, we only have about 50,000 of the most vulnerable children 6 months to 4 years who are actually registered in the Get Vaccinated system. And one of the steps that we're taking today is that we're going to take information that is in the provincial registry and use that to send a notification through Get Vaccinated to parents. We know that some of those notifications won't reach them because the telephone number we have is possibly a landline, but parents in the age group of children of 6 months to 4 years are, very savvy. Most of them operate off mobile phones, and so we're hoping that the majority of these notifications will go out and reach them, and we will encourage them to get their children registered. Then we can send them an invitation link, and they can book an appointment in many of the health authority clinics that are around the province, waiting for them to come in and receive their vaccine. There are lots of options available for parents to bring their children and youth in to get vaccinated. We have about 2,000 family doctors who have received influenza vaccine through the health authorities and who are able to provide vaccination. So, parents can phone their family doctor's office and see if there's vaccine available and bring their children in to get vaccinated. There are health authority clinics if your family doctor does not have vaccine, and these clinics are specifically set up to welcome children, to make them comfortable. A few extra touches, coloring. Some of them are able to put decorations on little Christmas trees. There are balloons, and we generally try and make those children's clinics, a very safe and comfortable place for children, especially the little ones, to feel okay. And for infants and toddlers, for children 5 to 11, they can receive their vaccine at a pharmacy as well. And there are about 250 pharmacies across the province who are welcoming children in that age group, 5 to 11, and providing vaccine. But actually, any pharmacy, is legally able to provide vaccine to children 5 to 11. So generally, as you can see, we've got a lot of access around the province. We have about 140 health authority clinics that are designed just for children. And there are thousands of appointments available on the Get Vaccinated system. At the end of this week, we'd like to sort of have a blitz, as I called it, a Vaxafluosa, to welcome kids. There's a special effort that's being planned by the health authorities, by our pharmacy colleagues, and we hope by our family physicians to really make an extra effort. If you get Friday, Saturday, and Sunday and get a vaccine, you're ready for 2 weeks away when your immune system has responded and you're moving into your holiday season with your family. So December 9th, 10th, and 11th, a special effort. Lots of walk-in availability for families to bring their kids in. There's a lot of effort being made to make sure that we've got the vaccine available and it's in convenient places and that we're able to welcome families. We encourage families to book an appointment if they can through Get Vaccinated. And as I told you a few minutes ago, we're going to send out notifications to families who do not have their children in that system to encourage them to do that. So just a little note on what you need to get your child registered and Get Vaccinated BC. First of all, you go to the website, getvaccinated.gov.bc.ca. You need your child's full name, their PHN number, their date of birth, and the postal code where they live. That's all you need, and you can get your child registered, and within a few hours, you will receive an invite to actually book them into one of the many clinics around the province, and if they're a little bit older, to a pharmacy where they can get a vaccination. So I'm going to close there just to say we have ample vaccine. Most vaccines in the influenza category can be used for children. As Dr. Henry mentioned, we have some flu mist still available, and that's for children who really have a problem with a needle. You can ask for that at the clinic. But generally, there's vaccine. There's a lot of information on the government website, on the health authority websites, on the BC Pharmacy Association website, and on BC CDC's website for information about influenza vaccine, for where you can get it. We want to make it, very, very easy for people to feel like they have access to, what do they do and where do they go. And the Provincial Call Centre is always available to answer pretty much any question and book your child in if you can't get to it using the internet or online.